Hi there, I'm Dr. Charlie Liu, and today in this video I'm going to be talking to you about some different signs to watch out for that might indicate that your child can't breathe properly. So this is a part of a series for parents on how to spot signs of illness in your child, so you know when to go and see the doctor. And today we're going to be talking about the breathing system mostly. So obviously there are lots of different illnesses that can affect your child's breathing, things like chest infections, wheezes, bronchiolitis, asthma attacks. So the aim for the video is not for you to be able to diagnose your child. That's obviously the doctor's job. It's basically just if you've already seen the doctor and they've hopefully checked your child over and said, it looks like everything's okay right now, so go home and come back if there's anything to worry about. So this video is going to tell you kind of what to watch out for if there is something to worry about. So there are a couple of different signs that we're going to talk about, 5 in total, but do use your common sense as well. Obviously, if your child is going blue, if they're not breathing at all, if they're going in and out of consciousness, if they're sort of floppy and unresponsive, don't wait for a GP appointment, do just call 999 straight away. Right, so the first thing I'm going to talk about is the simplest one to watch out for, and that's when your child is just breathing faster and harder than usual. We would probably call this respiratory distress if we were using medical jargon, but it basically just means that they are clearly kind of having some difficulty breathing and they're trying to puff away like this. They may not be able to talk if they're old enough to talk, and this is probably the first and most easiest sign to see if your child is having some difficulty breathing. Now the caveat to this is that if they have a high fever at the moment, if their fever's up at let's say 39 or so, they probably will be breathing quite fast. So this is less of a useful sign when there's a high fever because that can just come on. So do give them some paracetamol and ibuprofen on a regular basis if they're still spiking fevers. And if they come down, if the fever comes down and your child is still having some difficulty breathing, if it still looks like they're puffing away and breathing quite hard and fast, then do contact your doctor. So the second thing that we're going to talk about is noise. So this is quite easy to hear, obviously, and there are a few different types of noise that can be indicators that your child's not breathing well. So the first one is something called stridor. So stridor is a high-pitched inhalation noise that happens when the airway, particularly up here, is getting a bit blocked off. And that can happen for a few different reasons. Croup is quite a common one in very young children. It may be that your child has inhaled a foreign body and it's stuck in the throat. And allergic reactions, severe allergic reactions that cause anaphylaxis can cause the throat to swell up. And so the noise that you're watching out for sounds something like this. So it's basically an indication that the airway up here is narrowed. It's an inhalation noise, not an exhalation noise. And that's usually a sign that things are pretty badly wrong. So if that happens, do call 999 rather than your GP, because you want to get them seen as soon as possible and tell them that they're having difficulty breathing and it's a child. They should send an ambulance pretty soon. The second noise that we're watching out for is wheeze. So I'm not going to pretend to do the wheeze noise. I think you all know what it sounds like. And this is quite a common thing in under 5-year-olds when they have a viral infection, something called viral-induced wheeze. Or in older adults, it can be a sign of an asthma flare-up as well. So the wheeze noise is something that can be serious. So if it's a new thing that's happened since you've last seen your doctor, do go and get it checked out. If your GP has already heard the wheeze and they said that it's nothing to get too worried about, or if they've given you some inhalers, then obviously just watch for any worsening of the wheeze or worsening of the shortness of breath. So the third thing to watch out for is something called tracheal tug. So tracheal tug is a sign where the lungs are having a bit of difficulty getting the air through, and it causes the pressure around the windpipe to make a little dip there. So the area that you're looking for is just here above the collar, in between these two muscles here, and I can just kind of demonstrate it by covering my mouth and nose and trying to breathe in. And what you're watching out for is a little dip right here. So that's what it looks like. That's the little area that you see tracheal tug. And again, if that's a new thing since you've seen your GP, go and get it checked out. Number 4 is something called recession. So recession, similarly to this, is a bit like where the lungs are trying to get air in, but they're struggling to do so. And so you see that the ribs almost seem to kind of suck in a little bit every time they take a breath. You can see it in between the ribs, and you can also see it underneath the ribs, just under the chest there. I don't have any original video of this happening, and it's quite difficult to demonstrate because it doesn't happen in adults. So I'm just going to put a link in the video here. So do watch it because it's a bit easier to understand than me trying to describe it. And again, if that happens, go and see your GP. And the last sign that we're going to talk about, number 5, is a slightly subtler sign for younger babies. So we're talking about babies who are still on the bottle or the breast. And this is that if they're trying to feed and they're not managing to make it through the feed because they're having difficulty breathing, that's something that you should see a GP about. Now, the caveat to this one is that obviously babies, when they're feeding, they use their mouths, and that means that their nose is going to be the main source of air for them when they're feeding. So this isn't always a serious thing. It may just mean that the nose is blocked off, which obviously happens all the time in common cold infections. So this is a slightly subtler sign, and if this is just because the nose is blocked, all it means is that when you're feeding a baby, you might just need to give them a few breaks, feed them for a minute or so, let them have a little bit of a break, catch their breath, carry on with the bottle or the breast, and you might just need to break up the feed into lots of different segments instead of doing it all in one go in 10 or 15 minutes. But if the nose isn't particularly blocked, it might be a sign that they're struggling to get some air in, so do get that checked out by your GP. Now, I should close by saying that if you have a very young child and you're not quite sure about what you're looking at or what you're looking for, then do just go and see your doctor. We're very cautious about children in general, and the younger the child, the more cautious we are. So we have a very low threshold for reviewing young children, babies under the age of 1, for example. If they're a really little baby under the age of 3 months, who hasn't even had their initial vaccinations yet, we're super cautious. So it doesn't matter if you've already been to see the GP a couple of times. If you're worried, just go and see them. We would rather waste 1,000 appointments rather than let a single baby get seriously ill. So don't feel like you're wasting anyone's time. So hopefully that's been useful for you. I'll put the link to that video looking at recession in the description below as well, so you can click there. And I'll also be doing some other videos looking at signs of hydration, dangerous rashes and fevers, so watch out for those as well. Alright, I hope that's been helpful for you. Thank you very much.